this second phase of COVID in a big way and in a very, very tragic manner. But now that the COVID numbers or the active cases are coming down, we are also, as doctors, at the same time, we are seeing a lot of post-COVID complications. Now, these post-COVID complications are a huge challenge to the medical community. But somehow, even we doctors are baffled, and even the general public at large do not know about these post-COVID complications. So this is a humble effort from the IMA Margao branch to educate its viewers and general and public at large when we talk about these post-COVID complications and scenario. And today we will be talking to Dr. Rupa Valavlikar, who is a very well-known dermatologist from Margao, because we've been seeing a lot of skin-related issues in post-COVID patients. Now, can I begin with Dr. Rupa? Welcome to this, and we're thankful that you have given us your time.
Thanks, Babita, for introducing me. And I'm also happy that I'm getting to talk on this subject because of IME, efforts of IME Margao. So what we are seeing now, post-COVID complications, in fact, are more than what we saw in the last wave. This wave has become larger and more intense also. And people also have become more conscious of the complications that they should approach post-COVID also. Okay. So now, since you mentioned that post-COVID skin complications, I'll only be talking about the most common complications that I have seen in my clinic or when people ask me, because I have been monitoring home quarantine people since last wave.
In fact, you have been very active in the teleconsultation group.
Yeah. And IMA Margao has given us this opportunity to do so. So there is a one-to-one communication with the patients before, during and after. Okay. So what I would like to say is the most common complications could be because of COVID itself, because of the treatment given for COVID, and thirdly because of circumstances which are because of COVID and not directly related to the treatment or directly related to COVID. So I will first talk about the complications which we see because of COVID. And the most common side effect, Babita, is hair fall.
Is it?
Tremendous hair fall, like chunks of hair fall. And women, mostly the people who approach me are women, because women, even if they lose a few strands, they get
very
panicky.
conscious.
So they have come with this lot of hair fall, diffuse alopecia, very panicky.
Is it?
And it is all because of the severe infection which they have had. Sometimes even asymptomatic patients have developed. And it does improve. It comes after about 4 to 6 weeks after the active infection and takes at least 1.5 to 2 months to be okay. But with our routine treatment, what we normally give for hair fall and tonics and all, it improves.
So I think that's a good thing that it improves.
It improves. Yeah. And in fact, I feel that if people have to know that such a major hair fall is going to happen, then they'll take more care that they should not get COVID, as you say. They'll be more careful. Then after that, we see acne, a lot of acne. Now acne, actually now we have seen increased cases of acne.
I think I'll just interrupt over here. Acne is in medical terms, and
pimples.
It's pimples, or it's like getting boils or like pimples in
zits. In zits, lay people call it zits also. So the acne itself has increased now since COVID has started because of the mask. Yes. And there's a term now defined for it, which is called mask acne. And previously we used to see acne on the T-zone, and now we see here
in this same zone where the mask
is there. It could be because of friction, activation of sebaceous glands, unhealthy masks, meaning not very clean masks.
Clean masks.
Yeah, so synthetic masks. So that also is a which lasts beyond COVID, because these infected people have to wear the mask continuously. And post-COVID, what happens is that this is again another complication of the treatment of COVID, because many of the patients are put on steroids, oral steroids. You have heard that.
That's true.
Steroid is one of the major treatment for severe COVID cases, and steroids are known to give rise to acne after some time. So the patient gets cured, but he comes with acne, and this acne is a little unusual. We call it steroid acne. You get it on other parts, even on the trunk you can
on the
get
chest.
Once the effect of the steroid goes down, the acne goes down. We have to treat it like normal acne.
Okay.
So these are the two most common things that we see.
Something that you see with the steam or anything?
We do steam, but that is a complication which is not directly related to the disease, nor it is related to the treatment. there is a tendency to take hot steam because people feel hot steam will kill the virus.
And which is actually a myth now.
Correct.
Yeah.
Because the steam is given to clear the nasal passages. But I have seen a few cases, especially people with sensitive skin, this particular part has become totally red, erythematous, peeling, as if like a severe sunburn.
Okay.
So that is one of the reasons.
Because in fact they say the steam burns are worse than the hot water burns, actually.
As the patient was so worried whether it is the complication of the tablet which had taken, but we ultimately realized the pattern comes and we have to just give soothing lotions and all that, and it passes on. Now, beside that, now you about fungus infection.
Exactly. So this is now as far as the actual COVID thing. Now, also post-COVID, which is probably drug related or because of the medication, I'm sure a lot of fungal infections also have come up. So will you throw some light on that?
One, this drugs can definitely, because mostly we use antiviral drugs and we use steroids and few antibiotics. So what happens is that there is a reason for the fungus to come back as a rebound effect.
Yeah.
You must have heard, all of you all, because of mucormycosis, which is now people call it black fungus. Now there is something called as white fungus, which is actually
yellow fungus. And all
white fungus is actually candidiasis, which we knew before.
Yeah.
But mucormycosis is something because the immunity of the patient is down. This is a very, very rare fungus, and it starts from the nasal cavity or around the eye, around the mouth, and this parts mostly it starts in this parts. And slowly starts eating up your flesh and skin.
And the bone,
Yeah, it can start with small red or black dots or discharge from the neck, pain, swelling, eye also comes out. These are the signs of mucormycosis. Babita, actually mucormycosis, although it's a fungus on the skin, it is in the department, it falls into the speciality of ENT, ear, nose and throat. Okay, so they see more cases of mucormycosis.
No, since we were talking about fungus, I thought we would
so, but we have to be all aware.
We have to be. In fact, this program is to make our viewers aware that these things are existing and when to seek help, medical help.
Exactly.
When to go to the doctor. Just don't stay at home saying that no, I know now I've recovered from COVID. No, but these are the post-COVID complications that we can have.
Exactly.
Another thing I would like to ask you is, we see in our doctors group a lot of images are exchanged about hemorrhages, like tiny black spots on our skin. Sometimes the tips have become bluish. So can you tell us something about that?
So that is also called because of thrombosis. Thrombosis are small clots. And there is something called as microthrombosis. Even minor, small, tiny clots are formed because of the disease itself into our capillaries. The
fine blood vessels.
And normally the capillaries are at the tips,
Yeah.
So that is why we see at the tips of the fingers and toes reddish, purplish discoloration.
So basically in our simple कोंकणी आम्ही म्हणतात तसे जे काही आमचे सगळ्यात बारीक ब्लड वेसल्स असतात ती ब्लॉक जातात आणि किणेतात
swelling जातात, सूज येतात. So that is, in fact, that is known as COVID toes. COVID fingers. That is mostly seen in very severe cases. But we have seen, there are small dots which happen on the extremities, patacher, payacher, small dots like purpuric lesions. म्हणजे बारीक रक्ताचे कसे dots येतात. And that is because of those small thrombi, like clots which are formed into the skin. They हळूहळू आपण मागे dissolve जाता, but it needs to be treated because we don't know. Sometimes this thrombi can happen in other delicate parts of the body. It can happen in the lungs. It can happen in the brain, it can happen in the heart, it can happen in the intestinal tract.
And I think that's been a big challenge to the medical community and the medical fraternity of this thromboembolic phenomenon.
Yeah.
And I think it's really nice that we are talking about this today because of our exposure to lot of literature and the kind of a give and take that has happened from various doctors and various sources that the information has come up. Dr. Rupa,
we need to investigate this.
Yes.
So just don't wait that this will pass off.
Okay.
When you see blood clots, it could be dangerous. So the patient has to be re-investigated. Is clotting, bleeding time, they have to be investigated. Okay.
Okay.
So this is
Yeah,
something
because it
which
can
cannot
also
be
lead
ignored.
to some major
Exactly.
problems.
It cannot be just
yeah,
ignored.
it cannot be ignored
Ignored.
at all. Secondly, Dr. Rupa, I would like to ask you is we talked about mucormycosis in very briefly, but I think more than mucormycosis, because the patients have been on steroids, we've been seeing a lot of oral fungus म्हणजे आम्ही म्हणतात ते आम्ही
मोवे
ताका मोवे
कोंकणीन आमी
म्हणतात
मोवे म्हणतात.
लहान भुरग्यांक बी पयलीं जातालें पळय मोवे
मोवे
म्हणतात
ओरल थ्रश.
Oral
A
thrush.
lay person calls it oral thrush. ताका मोवे म्हणतात. So this is a different type of fungus and actually that is a white fungus. तोंड फुट्टा भितर आनी भितर सगळे अशे साली वता, अल्सर्स जातात. So that is common even with normal antibiotics. It is common with long-term steroids. So it is common in people who have diabetes. It is common in people who have poor oral hygiene. सारखे घोट घेना, दात घासना, तांकां बी ते खूब जाता. दात पिड्यार जाल्ले आसात.
म्हणजे जे पळय शिकून आतां केन्नाय जाणटे मनीस किंवा जे पोस्ट कोविड सिवियर केसीसांक जर परत घर येतात, म्हाका दिसता तांकां तूं एक थोडेशें टिप्स दीत की हाव दे शूड मेंटेन देयर ओरल हायजीन ऑर स्कीन हायजीन.
हय, सो पयलीं म्हणल्यार सारकें गळगळे घेवपाचे. You require to take vitamins for a long time with B complex or some lactobacillus for a long time. आनीक जर अशें कितें दिसलें न्ही जाल्यार यू हॅव टू कन्सल्ट अ डॉक्टर बिकॉज तुका एंटी फंगल ट्रिटमेंट स्टार्ट करचो पडटलो. लावपाक भितर तोंडाक दिवचें पडटलें.
पेंट यू कॅन
ओरल कॅन्डिडायसाचो ट्रिटमेंट फिक्स आसता, ओरल आनी लोकल एंटी फंगल्स. But
don't neglect it. The
proper hygiene
is very important. Because this oral candidiasis can also go inside and can give rise to esophageal candidiasis and so many things. म्हणजे दुसरे भाग आपले अफेक्ट जावपाक शकतात. So in other words, Dr. Rupa, what I would like to highlight here is एकदा कोविड जालो म्हणून आपल्याक कांयच जावपाचें ना अशे तरेचो हो व्हायरस न्ही. इनफॅक्ट कोविड जातकीर आज आमकां लक्षांत येवपाक लागला की वी हॅव बीन I mean, there is a huge challenge of post-COVID complications, and these post-COVID complications are in the field of dermatology, in the field of medicine, in the field of chest and pulmonology, in the field of surgery and various other things, and it has been a challenge. Almost every day new things are coming up. So in such a scenario, I think today with Dr. Rupa, we have just talked about some common skin conditions. There
is one common skin condition which I must mention, that is urticaria. जाका आमी कोंकणीन पिताम म्हणटात. In fact, पिताम जी येता न्ही, that can be a presenting sign of COVID. It can be a presenting sign of COVID. So जर पिताम आयली अकस्मात पेशंटाक आमी कोविड टेस्ट करपाक लायतात. आनी खूबदां ही पिताम जी वखदां दिल्या ताजे खातीरय येता किंवा कोविड बरें जातकीर पासून आपुणूच कोविड येता बिकॉज ऑफ दॅट इम्युनॉलॉजिकल चेंजीस एंटीबॉडीज ते पिताम इज क्वायट अ कॉमन थिंग. आनी रॅशीस बी तरेतरेच्यो अश्यो आंगार तांबडे तांबडे अशी जशें आतां आमी व्हायरल रॅशाक कशी रॅश येता तांबडी तांबडी तशे तरेच्योय बी रॅशीस दिश्टी पडटात आमकां. सो हे दोनी क्वायट कॉमन. आनी एक जाणा बबिता, ह्या दिसांनी कोविड स्टार्ट जायत पासून आमी सर्पीची खूब केसीस पळयतात. हर्पीस झॉस्टर.
बट आय थिंक ताका एक रिजन आसा न्ही, कित्याक दोनी ज्यो पळय गोश्टी आसात ते आमची इम्युन रिस्पॉन्स कमी करतात. इम्युन रिस्पॉन्स कमी जालो की तुजी जे पळय पयलीं तो चिकन पॉक्स वेक्सेला व्हायरस जो पळय आमचे नर्व एंडिंग्सांक आसता तो परत एक्टिवेट जाता, परत जागो जाता आनीक हे हर्पीसच्यो केसीस
खूब वाडल्या. इवन कोविड जावन गेल्ले लोकांकूय बी सर्पी किंवा जावचे पयलीं सुद्दां खूब जाणांक आयल्या किंवा जर कोणाक कोविड जाला न्ही तांच्या रिलेटिव्हा मदीं सुद्दां सर्पी मेळ्ळ्या. पूण एकूच हांव सांगपाक सोदतां की फॉर हर्पीस झॉस्टर जाका आमी सर्पी म्हणटा की आमची बरी वखदां आसा आमची मॉडर्न मेडिसिनाची. कळ्ळें, हांव एलोपॅथी म्हणना वर्ड, आतां आमी मॉडर्न मेडिसिन वर्ड यूज करता.
एक्झॅक्टली मॉडर्न
मेडिसिन. सो ताका आमची बरी वखदां आसात. सो गांवठी बिवटी वखदां करून कितें कितें लेप बीप लावन आनी पथां बिथां करून
ताजो सायड इफेक्ट जावपाक शकता, भुरभुरपाक शकता.
सो ते एक व्हेरी कॉमनली वी आर सीन. सो दीज आर मेनी. आनी दुसरें आनी एक म्हणल्यार हातपांयाच्यो साली वतात. कोविड काबार जातकीर ताका आमी कॅरेटोलिसीस म्हणटात. खूब साली वतात. पण हे जेन्ना खंयच्याय मेजर इलनेसाक जाता मनशाची हात पांयाच्यो साली वतात, विकनेस आशिल्ल्यानी जाता, stress related जाता, पण then that we can take care. So these are the most common.
I think in a nutshell, I'll just put it that dermatology किंवा skin conditions किंवा skin complications are basically due to COVID and they could be because of the treatment given for the COVID. एक म्हणजे डॉक्टर रुपान तुमकां सांगलें तशें केस गळपाक शकता, दॅट इज एक्सेसिव्ह लॉस ऑफ हेअर फॉर अबाउट 2 months 3 months अँड विच कम्स बॅक विथ एडिक्वेट ट्रीटमेंट. सेकंडली इज मास्क एक्ने, म्हणजे ज्या पळय भागाचेर मास्क घाला थंय पिंपल्स येवप. दुसरें म्हणजे सगळ्याक रॅशीज येवप, अशें करून हाताक पिता मारिल्ल्या भशेन सगळें जाता. अँड देन चड स्टीम घेतिल्ल्यान सगळ्याक बर्न्स जावन इरिटेशन जावन तोंड सगळें तांबडेच जाता आनी तो एक सायड इफेक्ट. सो दीस इज बिकॉज ऑफ कोवीड. Secondly, not because of COVID or treatment related, because of the steroids and so many other treatment that we have taken. एक तर फंगल इन्फेक्शन, म्हणजे तूं ताका कोंकणी शब्द कितें मोवे म्हणटात आमी, तर तोंड फुट्टा सगळें. मागीर म्युकोरमायकोसिस इज ऑल्सो न्यू, इट्स नॉट अ न्यू डिसीज, इट वॉज नोन, पूण तें आतां चड दिश्टी पडपाक लागलां आमकां बिकॉज ऑफ द कायंड ऑफ ट्रिटमेंट दॅट वी हॅव बीन गोईंग थ्रू. आनीक ल्हान ल्हान अशें करून आंगार टिपके 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 अशें करून बारीक ब्लिडींग स्पॉट्स अशे जातात. पूण तशें जालें जाल्यार केन्नाच आपणे घरा कडेन रावचें न्ही. इमिजिएटली आपले डॉक्टराक, फॅमिली डॉक्टर जावं किंवा तुमचो कोणी फिजिशियन जावं किंवा तुमचे स्कीन स्पेशलिस्ट जावं ताका दाखोवचें, कित्याक दीस कूड बी अ व्हेरी अर्ली सायन ऑफ समथींग मोर सिरियस टू कम. तर ह्यो सगळ्यो मागीर हर्पीस म्हणटा तशें आमी सर्पी म्हणटात तें जावपाक शकता. हातपांयाच्यो साली वचप आनी अशी कितलीशींच कारणां आसात जी आज आमी उलयल्यात हांगा, ज्या खातीर म्हणजे तुमकां हें कळचें आनी यू शूड बी अवेअर ऑफ दीस थिंग. सो केन्नाच हें आपल्या जालें म्हणून घरा कडेन बसनाकात, प्लीज वचात. खूब जाणांनी कोविडा वेळार अशें केल्लें की जेन्ना पळय चड जाता तेन्नाच दोतोरा म्हऱ्यान धांवतात, आनी इट रियली हॅज बीन व्हेरी सॅड अँड ट्रॅजीक, कित्याक त्यो केसीस मागीर हाताभायर पाविल्ल्यो आशिल्ल्यो असतात.
ह्यो चडश्यो सगळ्यो स्किनाच्यो केसीस आमचे ट्रिटेबल.
एक्झॅक्टली. सो दॅट्स अ व्हेरी गुड न्यूज.
जस्ट तुमकां अवेअरनेस जावची आनी तुमी त्या टायमार आपल्या डॉक्टराक तुमी अप्रोच करा.
एक्झॅक्टली, कित्याक मातसो ट्रिटमेंट बदलचो पडटा, फंगसाचो ट्रिटमेंट दिवचो पडटा, बट दीज आर ऑल ट्रिटेबल कंडिशन्स बट वीच नीड मेडिकल अटेन्शन. So please be aware of this, and thank you for listening to us and for giving us attention, and I hope this will help you all. And Dr. Rupa, thank you so much for being over here and giving us your time and knowledge. Thank you so much.
Thank you.
Yeah.